Tattoo Parlor in Prison, Looking to Decrease Hepatitis C Rates by Estrellita, Montoya. Hepatitis C infection among inmates is significantly higher than that of those persons outside of prison. According to the CDC, in 2013, 1 out of every 3 inmates incarcerated has hepatitis C. Correctional facilities are required to medically treat inmates to include those infected with Hep C. The problem with this is that infection rates are on the rise and the costs to provide hepatitis C treatment is generally much larger than the entire health services budget in corrections. Prisons must look at ways to minimize increasing rates of hepatitis C prevalence among those incarcerated. Complications of hepatitis C include chronic hepatitis C symptoms, which are fatigue, nausea, decreased appetite, as well as muscle and joint pain. Jaundice is when there is yellowing in the pigment of skin and sclera of the eyes. Ascites is the accumulation of fluid within the peritoneal cavity because the liver is not able to produce enough protein to retain fluid within the bloodstream, and this is according to emedicinehealth.com in 2014. Complications also include cirrhosis, cancer of the liver, end-stage liver disease, liver failure, and death. All of these complications cost state prisons an enormous amount of money, but it is more important to consider the lives that are affected because of this disease. The most common ways that hepatitis C is spread is by sharing of needles to inject drugs or for body piercings, and another very common way is by prison tattoos. And according to a study by Thome and Holmberg in 2011, the number of piercings and tattoos has increased significantly over the past 10 years. The virus itself can live for a long time in contaminated ink and on the needle used for tattooing. It's no surprise that inmates are innovative, and basic tattooing equipment may consist of any type of small motor that can be taken out of radios or CD players. Ink can come from pens, heated styrofoam, or any other liquid that can be a stainable dark liquid. And needles are fabricated from anything sharp, to include simple staple. How do we address this issue? As a nurse, I consider all inmates being at risk for infection of hepatitis C and MRSA. Participating in illegal tattooing with unclean, reused equipment places them at further risk for ineffective health management. There is also knowledge deficit as it relates to the disease spread and process. As a form of primary prevention, introducing a state-run tattoo parlor for inmates could help bring down numbers of newly diagnosed cases of hepatitis C, which would also mean a decrease in costs spent to treat patients with hepatitis C. This would be accomplished by using sterile equipment within a clean environment, which would also be beneficial for inmates in the department because this program could also reduce the rates of methicillin-resistant staph infections, or MRSA, within the prisons as well. Regardless of the amount of educational hepatitis C posters hung in rec rooms, chow halls, or the continuous showing of educational slides regarding the virus on the inmate television, inmates' behaviors aren't changing. They continuously put themselves at risk of the virus. According to an online article from 2011 by Wapner, Corrections Services Canada offered clean tattooing to inmates by means of a tattoo shop. This program was only piloted from 2005 to 2006 and was closed down by the serving government. But there were still benefits that flourished from the short-run program. The program gave hope to a simple, low-cost step to addressing the hepatitis C epidemic. Ethical issues to be considered include changing the policy that Department of Corrections has regarding tattoos. The policy could be changed to allow prison tattoos in the parlor in the presence of security staff and to be paid for appropriately, as well as making it illegal to perform or obtain by any other means a tattoo within the prison walls. But given the increase in tattoos and their popularity outside of prisons, this change may be accepted without much government or public resistance. Another issue that would need to be looked at would be the types of tattoos allowed. There are many tattoos that identify inmates with gang affiliation. Of the current resources available for this program, the positive is that there are many talented artists in prison. Also, the space needed for the parlor wouldn't need to be big, and inmate work crews with supplies available within the complex could complete the setup or construction. Of course, there would need to be equipment and supplies purchased. But sharps inventories could also be completed at the beginning and end of every shift by security staff. So who would support this? As controversial as this idea seems, it would still have support not only by inmates, but also human rights advocates, as Wapner addresses in her 2010 article. Healthcare professionals can also appreciate the concept for the benefit of decreasing the spread of bloodborne disease and staph infections. To implement this program, a budget would need to be established. The program would start out small and in a low custody level unit. Inmates from this unit could offer some ideas or insight to the program through a town hall meeting. Prison officials would also need to meet to establish the rollout of the program to include the area or space that will be utilized for the tattoo shop, the labor necessary to get it up and running. A new policy draft would need to be established as well as post orders for security officers assigned to the tattoo shop. Prison officials need to also discuss the positions that inmates will be hired for, such as artists and porters, and also need to discuss and set times of business. Outside tattoo parlors should be visited to observe the daily dynamic and function of the establishment, and OSHA requirements must be reviewed and read to begin and maintain compliance. Evaluation of the program should happen by tracking and following new cases of hepatitis C. The numbers of diagnosed hep C cases as well as costs of medical expenditures will be compared at 6, 12, and 18 months and compared to the numbers of the past 3 years. Medical staff from the unit could assist with tracking the number of staph and MRSA cases during the same time intervals and also compare those numbers with the past 3 years. The occupational health nurse can track number of needle sticks by tattoo contraband officers have received. And security staff can also track the amount of tattoo contraband seized in searches and compare those numbers to previous amounts prior to the program being initiated. In a very recent 2015 article written by Ross, it states that one pill of Harvoni costs $1,125, which means a 12-week treatment regimen could cost $94,500. Harvoni is the newest combination hep C medication approved by the Federal Drug Association. Getting back to the article by Wapner, the piloted tattoo shop in the Canadian prison facility, the cost of the program, which was just over $900,000, could have been measured as cost effective if 1 out of every 38 tattoo sessions helped to prevent a new hep C infection. The other noted benefits from the program: there was a decrease in confiscated tattoo contraband by prison guards. The risk of accidental needle sticks by prison guards could also possibly decrease, which in turn would decrease their risk of acquiring hep C via a needle stick during routine searches. In summary, the purpose of this population project was to address the astounding number of hepatitis C infection spread within the prison population. A third and nearing half of the prison population is diagnosed with hepatitis C versus the 1 to 1.5% of the outside public. The majority of these inmates will eventually be released back into the public, some having the virus and possibly placing communities at risk. Prisons need to take a stance and pilot a tattoo parlor program and see the outcomes for themselves. The goal of decreasing the spread of hepatitis C in prisons will benefit all stakeholders involved, to include the public population. This is a matter of health, as well as a public service. Thank you very much.